The House Health Policy Committee will come to order, and I do appreciate Representative Fuller's attendance. Would the clerk please take the attendance?
Chair Rogers.
Here.
Representatives Whitsett. Carter.
Here.
Headsman.
Here.
Neely. Here. Glanville. Kafia. Here. Conlon.
Here.
Farhat. Fitzgerald.
Here.
Miller.
Here.
Reingans.
Here.
Vanderwall.
Present.
Filler.
Yes.
Mueller. Van Workum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson.
Here.
Madam Chair, you have 15 members present. You do have a quorum.
Thank you. Representative Hadsma moves to approve the minutes from our meeting on October 26. Seeing no objection, the minutes are approved. Today we will hear testimony on and vote on Senate Bill 133, introduced by Senator Sean McCann from one of the esteemed counties in our state, Kalamazoo, which would establish an overdose fatality review board. Then we will vote on SB 227, which we heard testimony on last week. We will then take up the remaining maternal and infant health bills, many of which have substitutes, before voting to report to the floor. Finally, I will refer House Bills 5184 and 5185 to the Subcommittee on Behavioral Health. Like I said, first up, we will take testimony on Senate Bill 133. Senator McCann will speak to his bill, and we will hear from Abigail Grande from the WMU Homer Stryker School of Medicine and Dr. Anna Tart, a forensic pathologist, joining us virtually. Welcome, Senator.
Good morning. Thank you for having us this morning. And to the members of the committee, we appreciate the opportunity to testify before you today about my bill, Senate Bill 133. In recent years, we've seen the rise, of course, of illicit opioids in our communities, which we know has a devastating impact on families across our nation. This April alone in Kalamazoo County, we experienced a tragedy of 18 overdoses, including 10 hospitalizations and 7 deaths. While we have made some progress with naloxone availability, it is also crucial that we utilize the experts in our communities to continue to investigate the root causes so that we might better prevent these tragedies that have become far too common. It's very apparent that we need every tool in our toolbox to help address this epidemic, and an overdose fatality review team. These teams have been established and in use in states like Arizona, West Virginia, and Maryland in an attempt to help tackle this rising crisis. This bill would create the Overdose Fatality Review Team Act in order to provide the legal authority to counties or a cooperative group of counties throughout Michigan the ability to establish these teams. The purpose of the teams is to discuss drug overdose deaths and best understand the risk factors, identify trends, and propose harm reduction efforts to prevent future drug-related deaths. The legislation would make this an option available to any county in Michigan and not require it of any of them. It would also provide them with the ability to grant appropriate confidentiality protections for victims and families involved. State law currently includes similar allowances for elder death reviews and child death reviews. Overdose fatality review teams are collaborative efforts involving many community stakeholders that may include membership from the county medical examiner, county health officer, first responders, law enforcement, healthcare professionals, including forensic specialists, nonprofit agencies engaged in mental health and substance abuse prevention, and others as designated by the team. Thank you for your time and attention. We have a couple of other people here present and on Zoom from the Michigan Association of Medical Examiners and the Western Michigan University Homer Stryker School of Medicine, who can also speak to the benefits that overdose fatality review teams would have on their work in our communities.
Thank you. I think in the interest of time, we'll just take all the testimony and questions at the end, if that's all right. Abby, go ahead.
Thank you so much. Good morning, and thank you for allowing us the opportunity to speak with you today about Senate Bill 133. My name is Abigail Grande. I am a forensic epidemiologist within the Medical Examiner's Office at Western Michigan University Homer Stryker MD School of Medicine. Additionally, I am the Executive Director and the Affiliate at Large of the Michigan Association of Medical Examiners. I have a master's in public health and have been working in forensic pathology for 14 years. I'm an active member of several child and elder death review teams and also coordinate the child death review team in Berry County. I'm here today to speak in support of Senate Bill 133, which provides Michigan counties with the opportunity to form overdose fatality review teams similar to child and elder death review teams. And the primary aim is to review the circumstances surrounding these deaths to ascertain whether or not the death could have been prevented. This involves a comprehensive review of the individual's medical and social history, including healthcare records, rehabilitation attempts, previous overdoses, recent incarcerations, encounters with law enforcement and/or EMS, and substances that contributed to the death, etc. Through confidential and transparent discussion of these circumstances, we gain a much better understanding of the risk factors associated with these deaths. We may also identify gaps in access to harm reduction methods, including access to naloxone, also known as Narcan, or to substance use treatment. Currently, we are not able to do this. Without a Michigan statute protecting the confidentiality within these meetings, each death reviewed requires extensive de-identification, which takes countless hours of precious resources and further complicates this review process. In 2022, our office investigated and certified the death of 348 drug-related fatalities in the 13 counties that we served as the medical examiner. This accounted for approximately 17% of the deaths certified by our office in 2022. Preliminarily, there were over 200 drug-related deaths investigated by our office in the first 6 months of 2023. We are not alone in this endeavor, as medical examiner offices, EMS, hospitals all continue to be overwhelmed by these premature passing. Along with 10 other Michigan counties, 2 of the counties that we serve as the medical examiner have been piloting OFR meetings over the last couple of years. Some of their recommendations focus on destigmatizing medication-assisted treatment, improving education related to increased risk of overdose after not using regularly, and naloxone accessibility. In order to adequately review these deaths and propose harm reduction strategies that meet the needs of the communities that we serve, it is necessary to provide the same level of confidentiality to overdose fatality review teams that we already have in place for both child and elder death review teams. Thank you very much for your time and consideration of this bill.
Thank you. And to close out testimony on SB 133, we have Dr. Anna Tart, forensic pathologist with WMed, who is joining us on Zoom.
Good morning. My name is Dr. Anna Tart. I am a deputy medical examiner for 12 counties here in Michigan. I also am a member of the Michigan Association for Medical Examiners, and I am also the chair of the Government Affairs Committee for the National Association for Medical Examiners. This is a committee that oversees legislation countrywide that pertains to the work of us as medical examiners. We've seen multiple bills coming through to both harm and assist us as medical examiners in appropriately certifying deaths. As you heard my colleagues say, statistics for overdose deaths are overwhelming. We see them literally every day. Our goal is to serve the constituents, especially here in Michigan, in order to better provide care for those who are still living. One way that we can do this is through OFRs, by providing confidentiality in these review teams. We are able to collaborate with multidisciplinary teams across mental health, emergency medicine, community care, and forensic pathologists, epidemiologists, in order to better serve and assist in lowering the number of deaths in Michigan due to overdoses. We hope to assist Michigan in becoming an example for nationwide efforts in reducing the number of overdose fatalities. Thank you.
Thank you so much for your powerful testimony. Do we have questions? Minority Vice Chair Vanderwall.
Thank you, Madam Chair. Appreciate it very much. And I believe that I'll direct this to the good senator. I know that we had talked about this a little bit last year. Can you tell me how many states have instituted a program like this so far?
Thank you, Representative Vanderwall. As I mentioned, a few states, Arizona, West Virginia, and Maryland, and maybe the other folks might know the other states that are on the list, but it's multiple.
Great. And what have we seen
Wisconsin?
through those states and this group that's been put together in other states? What have the results been? Has it slowed the pace of overdoses? Has it done anything in lines of information that's come out? What can you share?
I think I would want to defer to the folks who have
That's fine.
done this and experienced it.
Thank you. So in terms of benefits that have already come out, in terms of other states, I can't speak for those in terms of statistical analysis. Specifically in the state of Michigan, where we've been piloting this since 2021, several benefits have already come out of this, including naloxone accessibility in jails and other libraries. In terms of how much it's brought it down, I can't say for sure. The pandemic has certainly been a hard-hitting situation that we're still trying to come back from. And with the continuous influx of new synthetic opioids and other drugs that are contributing to these deaths, I don't have perfect statistics to tell you that this will reduce the number as of yet. I think it's going to be a many-year situation, trying to learn more from these deaths before we can assess that appropriately.
All right, just one more last question, if I may. Have we determined, Senator, on what the cost is going to be to the counties to be able to operate this program?
Yeah, the cost impact is negligible because they have these folks already, it would become part of their role and not cost the state further dollars and not cost the locals further dollars. Is that
Correct.
All right, thank you.
Thank you. Representative Reingans.
Thank you, Madam Chair. My question relates to data sharing. So right now, some entities that receive federal funding protect substance use disorder treatment data more than they protect additional other kinds of health data, in part because it is seen as stigmatizing, and so you need extra permission and extra consent from the patient to disclose those records. So in this case, the patient will have been deceased, so they cannot give that consent. There are exceptions, including court orders to disclose that data. How is that going to be worked out if you need that data?
As the medical examiner's office, we are allowed any piece of medical history that we need for the investigation of that death. We do struggle with obtaining all of the mental health records that are necessary to review these cases. That's unfortunately kind of the nature of the beast right now. But again, as the medical examiner's office, there is a provision that allows us to have access to anything we need for the investigation of these deaths.
So it might be possible that the review boards, if established, might have slightly underreporting of people who were in active treatment at the time of the overdose.
So all of these overdose fatality review teams will be working with, and they already are, with the medical examiner's offices in these counties. So they're always going to be associated so that they can work through some of those details in terms of sharing that information as needed. But again, as of right now, everything is completely de-identified, so.
Okay, thank you.
Any other questions? Representative Hadsma.
Senator McCann, Ms. Grant, Dr. Tart, any of you can answer this question. How, if this overdose fatality review team or these teams are established, will the establishment of such team or teams complement, harmonize with current state efforts in this context?
It's a supplemental situation. Just like the prevention work that is done for child deaths, this is going to be an additional piece of the puzzle to help us better understand these deaths. There are several county, local, state organizations, agencies that work to help with the prevention of these deaths, but this is, again, another tool in our tool belt to hopefully be able to attack the epidemic.
Thank you.
Any other questions? Representative Conlon.
Thank you, Madam Chair. Thank you for your testimony today. You mentioned about the families. So beyond collecting this data to hopefully minimize this problem in the future, or figure out where some of these cases fell through the cracks, I imagine is part of the goal here. How is this helpful to the families to have this review?
So I think that in terms of families, the whole idea of overdose fatality review teams is to prevent future deaths. So although I can't bring back their loved ones for the families that have already lost, this is going to be to assess the situations in which current substance users or people with substance use disorders can access the appropriate care, and their families have access to the resources they need to help themselves and their loved ones with substance use disorders. So this is, again, to assess the entire situation, but it would be for that prevention of future deaths.
Thank you so much. We do have some cards to read in. Supporting the bill, Michigan Health and Hospital Association. Supporting the bill, Family Against Narcotics. Supporting the bill, Michigan Department of Health and Human Services. And supporting Michigan State Medical Society. Thank you so much for your testimony. Representative B. Carter moves to report SB 133 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett, Carter,
Yes.
Hadsma,
Yes.
Neely. Yes. Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingans.
Yes.
Vanderwall.
No.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
Pass.
Schmaltz.
Pass.
Thompson.
Pass.
Madam Chair, you have 11 yeas, 1 nay, 6 pass. Senate Bill 133 is reported with recommendation.
Moving, next we will take up SB 227. Do we have cards to read in for that one? This is the Senator Lowers bill. Representative Vanderwall moves to report SB 227 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett, Carter,
Yes.
Hadsma,
Yes.
Neely. Yes. Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingans.
Yes.
Vanderwall.
Yes.
Filler.
Yeah.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 18 yeas, 0 nays, and 0 pass. Senate Bill 227 is reported with recommendation.
Thank you for that unanimous vote. Returning to the maternal and infant health package, we will be voting on House Bills 5027, 5167, 5168, 5169, 5170, 5171, 5172, and 5173. Do we have cards to read in? Thank you. Supporting SB, well, we were at that one. House Bill 5027 and 5169 through 5171 is Michigan State Medical Society. The Michigan Organization on Adolescent Sexual Health, or MOASH, in support of all of those bills that I just read. And supporting 5027 is Henry Ford Health. And these two. Supporting 5172, Michigan Health and Hospital Association. Supporting neutral on the bill, 5137 is DIFS. Supporting 5169 through 5171 is Health and Hospital Association. And Nurse Family Partnership is supporting 5027, 5167, 5168, 5169, 5170, 5171 through 5173. On House Bill 5027, we have an H1 substitute with Representative Pahutsky. Would you please join us and share whatever changes you would like? Thank you.
Thank you very much, Madam Chair and members of the committee. The substitute's pretty simple. It just reflects some changes requested by DHHS to give them a little bit more flexibility when it came to the recommendations of ACOG, the American College of Obstetricians and Gynecologists. This was just to make sure that while the bill reflected the spirit of ACOG's recommendations, the department wasn't held as stringently to their guidelines should those change over time or anything like that. So it just provides a little bit more flexibility with that language.
Thank you so much. Representative Reingans moves to adopt the H1 sub on HB 5027. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett, Carter,
Yes.
Hadsma,
Yes.
Neely. Yes. Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Sorry.
Yes.
Miller.
Yes.
Reingans.
Yes.
Vanderwall.
Pass.
Filler.
Pass.
Mueller.
Pass.
Van Workum. Roth.
Pass.
Schmaltz.
Yes.
Thompson.
Pass.
Madam Chair, you have 11 yeas, 0 nays, 7 pass. The substitute is adopted.
Representative Ryan Gins moves to report HB 5027 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Woodsett? Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Kafia?
Yes.
Conlon?
Yes.
Farhat?
Yes.
Fitzgerald?
Yes.
Miller?
Yes.
Reingens?
Yes.
Vanderwall?
Yes.
Filler?
Pass.
Mueller?
Pass.
Van Workum?
Pass.
Roth?
Pass.
Schmaltz?
Pass.
Thompson?
Yes.
Pardon me?
Yes.
Madam Chair, you have 13 yeas, 0 nays, and 5 pass. House Bill 5027 is reported with recommendation as substitute H1.
Moving on to House Bill 5167, we have an H1 sub, which simply ensures that the blood pressure monitor is designed for use during pregnancy and fitted to the individual. Representative Glanville moves to adopt the H1 sub to HB 5167. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Woodsett? Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Kafia?
Yes.
Conlon?
Yes.
Farhat?
Yes.
Fitzgerald?
Yes.
Miller?
Yes.
Reingens?
Yes.
Vanderwall?
Yes.
Filler?
Yes.
Mueller?
Yes.
Van Workum?
Yes.
Roth?
Yes.
Schmaltz?
Yes.
Thompson?
Yes.
Madam Chair, you have 18 yeas, 0 nays, and 0 pass. The substitute is adopted.
We also have a substitute, Representative Glanville moves to report HB 5167 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Woodsett? Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Kafia?
Yes.
Conlon?
Yes.
Farhat?
Yes.
Fitzgerald?
Yes.
Miller?
Yes.
Reingens?
Yes.
Vanderwall?
Yes.
Filler?
Yes.
Mueller?
Yes.
Van Workum?
Pass.
Roth?
Yes.
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 Schmaltz?
Yes.
Thompson?
Yes.
Madam Chair, you have 17 yeas, 0 nays, 1 pass. House Bill 5167 is reported with recommendation as substitute H1.
We also have a substitute to HB 5168. These changes are at the request of Blue Cross Blue Shield of Michigan and applies cost sharing, deductibles, co-insurance, and copays to coverage of blood pressure monitors for pregnant and postpartum individuals. Representative Farhat moves to adopt the H1 substitute for HB 5168. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Woodsett? Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Kafia?
Yes.
Conlon?
Yes.
Farhat?
Yes.
Fitzgerald?
Yes.
Miller?
Yes.
Reingens?
Yes.
Vanderwall?
Yes.
Filler?
Yes.
Mueller?
Yes.
Van Workum?
Yes.
Roth?
Yes.
Schmaltz?
Yes.
Thompson?
Yes.
Madam Chair, you have 18 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Farhat moves to report HB 5168 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Woodsett? Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Kafia?
Yes.
Conlon?
Yes.
Farhat?
Yes.
Fitzgerald?
Yes.
Miller?
Yes.
Reingens?
Yes.
Vanderwall?
Yes.
Filler?
Yes.
Mueller?
Yes.
Van Workum?
Pass.
Roth?
Yes.
Schmaltz?
Yes.
Thompson?
Yes.
Madam Chair, you have 17 yeas, 0 nays, and 1 pass. The motion prevails.
On House Bill 5169, we have an H1 substitute to address concerns expressed at our last meeting and to explain changes contained within subs for 5169 through 5171. We have Representative Hood. Thank you for joining us on this early morning.
Good morning, and happy to be here with you all. Thank you for making time for the people of Michigan at 8 a.m. I am happy to be here to discuss a few changes to my bill, 5169. You'll recall that there were some questions about whether this work would happen at an OBGYN or at a pediatrician's office and the best venue for that. It was determined through conversations with stakeholders that the best way to proceed would to be to broaden the health professionals who will provide the services. So we have, quote, a health professional shall offer mental health screening described in the section. That would be inclusive of physicians, physician assistants, et cetera. And then we have some changes to the timing. The bill had originally called out that a postpartum screening would be done specifically at, I think it was 3 weeks, subsequently 3 months, and so on, up until 18 months. We have broadened that and provided flexibility between 0 and 12 months for a screening to be completed by a healthcare professional. And then subsequently that caused changes to 5171 and 5170 to ensure that we are in concurrence across those bills.
Thank you so much. Representative Carter moves to adopt the H1 sub to HB 5169. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Witset, Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingans,
Yes.
Vanderwall,
Yes.
Filler,
Yes.
Mueller,
Yes.
Van Workum,
Yes.
Roth,
Yes.
Schmaltz,
Yes.
Thompson.
Yes.
Madam Chair, you have 18 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Carter moves to report HB 5169 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Witset, Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingans,
Yes.
Vanderwall,
Yes.
Filler,
Pass.
Mueller,
Yes.
Van Workum,
Pass.
Roth,
Yes.
Schmaltz,
Yes.
Thompson.
Yes.
Madam Chair, you have 16 yeas, 0 nay, and 2 pass. The motion prevails.
Representative Conlon moves to adopt the H1 substitute to HB 5170. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingans,
Yes.
Vanderwall,
Yes.
Filler,
Yes.
Mueller,
Yes.
Van Workum,
Pass.
Roth,
Yes.
Schmaltz,
Yes.
Thompson.
Yes.
Madam Chair, you have 17 yeas, 0 nays, and 1 pass. The substitute is adopted.
Representative Conlon moves to report HB 5170 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Witset, Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingans,
Yes.
Vanderwall,
Yes.
Filler,
Pass.
Mueller,
Pass.
Van Workum,
Pass.
Roth,
Pass.
Schmaltz,
Yes.
Thompson.
Yes.
Madam Chair, you have 13 yeas, 0 nays, 5 pass. The motion prevails.
Representative Fitzgerald moves to adopt the H1 sub to HB 5171. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Carter,
Yes.
Witset, Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingans,
Yes.
Vanderwall,
Yes.
Filler,
Yes.
Mueller,
Yes.
Van Workum,
Yes.
Roth,
Yes.
Schmaltz,
Yes.
Thompson.
Yes.
Madam Chair, you have 18 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Fitzgerald moves to report HB 5171 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett, Carter,
Yes.
Headsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingens,
Yes.
Vanderwall,
Pass.
Filler,
Pass.
Mueller,
Pass.
Van Workum,
Pass.
Roth,
Pass.
Schmaltz,
Pass.
Thompson.
Pass.
Madam Chair, you have 11 yeas, 0 nays, 7 pass. The motion prevails.
On House Bill 5172, we have a substitute to address concerns from MDHHS and the Michigan Health and Hospital Association. To speak to the changes in the sub, we have Representative Glanville. Thank you for your work on this legislation, and please share what is included in the sub.
Thank you, Madam Chair. Good morning, members of the committee. Yes, we had a couple of conversations with some concerns from Michigan Hospital Association, also MDHHS. So a few things that we added to clarify the program, primarily to clarify that the program is voluntary. So no birthing hospital in Michigan is required to participate. We're also going to tie the program to incentives and funding that was already appropriated in FY24 budget to assist with the cost of Joint Commission verification as well as implementation. And this implementation of safety bundles for hemorrhage, hypertension, and sepsis. So this is work that's being led by MHA. And then also to remove any fear that the designation criteria in Michigan would conflict with the also voluntary Joint Commission verification program.
Thank you. Representative Reingens moves to adopt the H1 substitute to HB 5172. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett, Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Sub.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingens,
Yes.
Vanderwall,
Pass.
Filler,
Pass.
Mueller,
No.
Van Workum,
Pass.
Roth,
Pass.
Schmaltz,
Pass.
Thompson.
Pass.
Madam Chair, you have 11 yeas, 1 nay, 6 pass. The substitute H1 to House Bill 5172 is adopted.
Representative Reingens moves to report HB 5172 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett, Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingens,
Yes.
Vanderwall,
No.
Filler,
Pass.
Mueller,
No.
Van Workum,
No.
Roth,
Pass.
Schmaltz,
Pass.
Thompson.
Pass.
Madam Chair, you have 11 yeas, 3 nay, 4 pass. House Bill 5172 is reported with recommendation as substitute H1.
On House Bill 5173, we have an H3 substitute, which adds, quote, or guardian, end quote, on page 3, line 1, to ensure that information about enrolling a child in health insurance is provided to the parent or a legal guardian. Representative Hadsma moves to adopt the H3 substitute to HB 5173. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett, Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingens,
Yes.
Vanderwall,
Yes.
Filler,
Yes.
Mueller,
Yes.
Van Workum,
Yes.
Roth,
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 18 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Hadsma moves to report HB 5173 with recommendation as substitute H3. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett, Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingens,
Yes.
Vanderwall,
Yes.
Filler,
Pass.
Mueller,
Pass.
Van Workum,
Pass.
Roth,
Pass.
Schmaltz,
Pass.
Thompson.
Yes.
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 Madam Chair, you have 13 yeas, 0 nays, and 5 pass. The motion prevails.
House Bill 5184 and 5185 were recently introduced and referred to the Committee on Health Policy. It is my intention to have Chair Braybeck and the Behavioral Health Subcommittee work on these bills. Madam Clerk, please read in the provided letter.
The letter is dated November 2nd, 2023. Dear Madam Clerk, on October 19th, 2023, House Bills 5184 and 5185 were referred to the House Committee on Health Policy. These bills amend the Public Health Code to establish a multi-tier licensing system for social work licensure. I am asking the Subcommittee on Behavioral Health to review and make recommendations to these bills. With ongoing workforce issues in our state and the variety of work done by social workers, these bills warrant a deeper look into options which recognize the disparate scale and scope of that work. I am confident that the subcommittee will be successful and productive. Sincerely, Julie M. Rogers, Chair, House Committee on Health Policy.
Thank you. Representative Neely moves to excuse absent members. There being no objection, motion prevailed by unanimous consent. There being no further business before the committee, committee will stand adjourned.